Good morning. It's almost, I think, good afternoon. Again, we'll start the second session, and the moderator is Professor Jonas Gada, who is a big brother and friend who has been with me at the Mayo Clinic Rochester for a number of years, almost 2 decades. And now he is in Barrow Neurology Institute, and he is an expert in Alzheimer's disease, neurologist by training, and he will moderate this session. Thank you.
Thank you, Dr. Kabare. So my name is Jonas Gada. I'm a professor and director of global neuroscience at Barrow Neurological Institute. I'm also a research professor at Center for Biosensors at Arizona State University. I will be chairing this symposium highlighting diaspora initiatives. And there will be 4 speakers. Our first speaker is Dr. Gabayo Tafari. He is an infectious disease specialist. He is a member of the former COVID Advisory Council. Currently, it is called North American Advisory Council on Health and Higher Education. Without further ado, he will take the floor. We will try to keep it brief. We already had a fantastic marathon race symposium earlier. Now this one will try to keep it brief and on time. So Dr. Gabayo, take it.
All right, good day, everyone. Thank you for attending. I am very much privileged in what appears to be the most historical P2P conference today. So, so my presentation is experience of the Advisory Council throughout COVID pandemic. So we'll see what I would do is highlights of both the pandemic, the actions taken from Ministry of Health or Ethiopian government, and what we did here as a advisory group. So before I do that, Jesse might hate me. I have to update you what's going on COVID. This is a current as of October 14th, yesterday, how COVID is on daily basis, and you can see where COVID is, Europe and North America, but you can see Africa is very limited. And when it comes to days, also you can see, just trying to highlight and show you where COVID really is doing its damage. So here is the African CDC. Hurrah, CDC in Africa is having dashboard and generating these reports. The larger the circle, the higher the COVID cases in each country. And if you look at the days also, the larger the circle, it's death numbers in each country. So if we dive deeper in this graph, you can see in Africa, the leading country when it comes to cases and the deaths is South Africa, but I listed some other countries in there, including Ethiopia. So it's very minimal compared with Europe and North America. As you know, the North America data is driven by USA data. And if you look at the dates, it's the same. So flat line almost. So for this to happen, we cannot speculate, but there are good data coming out. So we can actually argue or discuss why COVID cases or COVID deaths, COVID severity are low in Ethiopia. So here, what I'm trying to look at is the impact of COVID or what COVID unmasked in countries like Ethiopia or third world, even in developed countries, which are called G8 nations. So pre-pandemic, everywhere, you can say everywhere, there was no clear direction, there was no pandemic plan in most countries, including this country. And then was there any structure enough to address the pandemic, including in Ethiopia? What Ethiopia did was established a committee led by the Deputy Prime Minister, and they went along with it. What they did was they set guideline. At the same time, the Advisory Council was established by, I think the call was made by His Excellency Ambassador Fitsumaraga and Dr. Nauga, P2P, and Dr. Guru were assigned to have or establish a committee. There were 28 members of this committee, largely from P2P. If this was a study, you could call it selection bias, but you can tell that who is who in P2P's participant or membership list. So the purpose of this advisory council was. By then, there were only 9 cases reported in Ethiopia, but COVID was raging in US. So our approach was not like, let's teach you. It's not, but we had experience with COVID. We were experiencing COVID here in the middle of the country. So we have something to say or share with our colleagues in Ethiopia. Nobody was prepared for that matter. So a multidisciplinary team was gathered up. We were focused on assisting Ethiopia to respond to COVID epidemic. Our colleagues or my colleagues were sat. There was an executive committee which was meeting almost daily, and the larger group was meeting once a week for 3 hours. I think we only missed a few days, and in all those meetings, the ambassador was sitting with us. So policy suggestions, treatment protocols, modeling, training, fundraising, and our message was kind of transmitted through the ambassador, but there were, we had another colleague who was a liaison officer, and then later on I was substituted. But so that's what the advisory council was doing. So when the first wave of COVID entered Ethiopia, as you know, testing was a big issue here too. I could share some things, but I will leave it. So was there any enough tests in Ethiopia? Were there adequate infrastructures? Were there enough staff to address this? And then it's not only staff, were there trained staff? So clinical care, it was not clear even here, so how to treat. So there was a global problem. And then we learned in the process, ventilators were a big demanded gadgets, and then with the ventilator, oxygen again. So what the advisory council did was, it acted on different recommendations. One of them I clearly remember, Dr. Antena Habte and Professor Talawan Adara were leading Ethiopian Airlines. There was a problem with death traveling back to Ethiopia, people who died of COVID, so that guideline has to be straightened out. And then I remember Dr. Kabada saying, mask saves lives. By then I myself was even on the verge of, on the edge, but that was a huge call from the advisory council. We developed different protocols, and one of our professor colleagues established a portal in there. You can see the portal. So we're into it, acting, advising, leading, sending, sharing all these protocols, and just hitting the highlights. So here. So the advisory council, we saw there was a lack of PPEs, medical devices, masks, and so on. So the advisory council, I can list a lot of things in this space just to fill it up what we did. But then one thing we did was the advisory council itself generates fundraising by itself, or help us or facilitates fundraising is from outside. I recall it's not only limited to COVID. Some of the members of the advisory council went out to communities actually and presented themselves with the ambassador to help or facilitate fundraising. So what we did was from masks, gloves, including COVID beds, were purchased and sent to Ethiopia. And usually when this issue comes in the meeting, there are some gunslingers, including the distinguished professor who was moderating this. He's quick, can I write some money here? So it was out of pocket. So it was idea, money, material, time, everything invested on this. So we were engaged heavily in the contributing. So I think the receivers will know or can attest to that. And so during the process, what we noticed was what was the public reaction. And the public reaction, later we learned that the public was thinking, oh, it's a capital city disease. So the periphery of it was not serious. In some areas in the country, actually, they didn't believe there was COVID. So for the government, it needed a lot of multidisciplinary or multi-sectoral approach to enforce the public health measures. One problem, which is global, you could say, was the message was unclear. So when the message not is clear, it creates a space for conspiracists or social media activists. So you can say anything about COVID. Everybody was having its own or his own, her own kind of opinion. So in time, the Ministry of Health got on it, and they built dashboard, and they were reporting cases on daily basis. And then they took this famous slogan called "No mask, no service." But then there was no mask, enough mask. So on the advisory side, we did our own media latest. We were all over, I can tell you, in Ethiopian media, here in diaspora media, in communities going on teaching. And we did a lot of webinars with our colleagues back home. We got engaged in community level advisory members. I myself went to or attended church and so on, or Ethiopian community in each state. So it was a high level education regarding the public awareness. So here is a famous dashboard from Ethiopia, just to show you. You can see that slogan there, "No mask, no service." This was as of July. I think lately they're not posting on a daily basis, but you can see when I say that it's a capital city disease, you can see where the COVID or the brunt of COVID was carried by Addis Ababa and periphery of Addis Ababa, or in areas where there is a large gathering urban population or some kind of industrial activity. So you can see clearly where COVID was in Ethiopia. And on this side, you can see how many lab tests and so on we may address those. So here is the recent, yes. Oh boy. So this is the recent, this is the recent one. You can see no mask, no services taken off, and a lot of things are cleaned up. Everybody is using the mitigation process. So other areas were impacted by COVID, clearly. Ethiopia, what Ethiopia did was they took a risk, and then to their credit, they said, we're not going to succumb to COVID. So we have to build COVID hospitals at different sections, and we will try to give regular healthcare in other hospitals. It was not a mixed match. Every hospital has to accept every COVID patient. That was a risky, but it was a wise approach. So you can see whatever we're taking today can get included in this. Vaccination is another issue. You know, we were not, or Ethiopia didn't get out of COVID through vaccination, but we learned that vaccination was not enough. We were getting leftovers. But members of the COVID advisory group, including virologists, seasoned people with vaccine, are working to establish a process where Ethiopia can herself build vaccines locally. It's easy. They gave you a genetic map or genetic code. You can develop that nowadays. So this is Africa CDC showing where the vaccination rate is compared with the rest of the world. Africa is very poor, 10 to 40%. That's where we are. So overall, this is a very exemplary, successful experience, I would say. And we learned that in the healthcare arena, it was appreciable that the Ethiopian government reached out, engaged with us in a very fruitful way. And this process was initiated by the ambassador. We can say a lot of things about the ambassador. About Ambassador Fisumarega. And then in the process, we were able to meet with high-level authorities, ministries in Ethiopia. We met also a lot of people through this process. We engaged we made a productive collaboration with community leaders in Ethiopia. I remember meeting with other opinion leaders in Ethiopia. So one thing we learned is the more we engage, the more we learn about healthcare and the provisions of healthcare in Ethiopia. So that's, and I would like to mention this unique situation in Ethiopia, just in the middle of the pandemic. I don't have to tell what happened. War broke out. Well, with COVID, there is mass mobilization and creating super spreading events. And then the other thing is economically, instead of fighting COVID, the resources have to be shifted to this activity. And the advisory council, apart from COVID or in addition to COVID, also did its share to aid, to send aid to affected people and affected areas. That's ideas, money, time, and everything. So overall, my message is observation from infectious disease point. Africa, including Ethiopia, did not avert, but escaped the disease. It's not what we did. We just escaped. For the rest of the world, my message is, unlike poverty, infections cross borders. So they have to respect infectious disease. It's just not economy. Thank you very much.
So our next speaker is Dr. Zelalem Yigzau from P2P. So he will get also a reminder. After 10 minutes, there will be a reminder, 2 minutes warning. So Dr. Zelalem is a medical doctor from Addis Ababa. He has extensive training and impressive CV. He has expertise in development, fundraising, in health systems, in epidemiology, advocacy, and policy. And he has worked in Eritrea, Ethiopia, Kenya, Uganda, etc. So the floor is yours, and you will get a reminder after 10 minutes.
Thank you, Professor Jonas. I'm Zelalem Atley. I will be giving you an overview of what we have done in the last 1 year, from September 2021 up to 2022 at P2P. What we did was organizational interventions have been reviewed. In the process of developing a compendium of past achievements and future strategies. We have engaged new staff and expanded our current portfolio, and we still need volunteers to fill up open positions at P2P. So we have reorganized P2P's overall goals as an organization into 4 major areas that would be to provide and strengthen the healthcare of developing countries through clinical and public health programs, to provide a high-quality tertiary education through university networks and capacity building of academia, to support peace building and conflict resolution by bringing in key stakeholders to roundtables, and to support emergency humanitarian assistance to needy populations in the Horn of Africa region, primarily and later on in sub-Saharan Africa. So that would be our vision. So currently we are conducting the following to improve the workflow and operations at P2P. We have done business process reengineering, and we have rearranged and restructured the team composition. We have done business needs analysis. We have reorganized our IT team and infrastructure. We are working on effective change management, and we are working on continuous management improvement. So our business needs analysis focuses on unique services, expanding manpower, our volunteer base, initiate budget planning and controls, initiate annual work plans with process and performance metrics, conducting annual evaluation of programs, and produce quarter reports from each unit. We in our emergency humanitarian assistance, we are being engaged with logistic management, so we have to strengthen that. And we are also strengthening our partner pool to expand our business portfolio. So I just want to tell you that P2P right now is an international NGO. Okay, we'll talk about the licensure. Its board, which is chaired by Dr. Anton Hapte, they have reviewed and amended the bylaws this year. We have manuals that are modified, the financial manuals, HR and procurement manuals. We have re-updated and renewed our website. So the overall structure looks like this. You cannot see it, but I can lead you a little bit. So this one is the board. Then we have the president, Professor Naugao. Then we have the P2P global advisors here. We have chapters in Canada, UK, Sweden, Finland, Germany, and Australia. We are working on reorganizing that so they are accountable to the president. Then we have the executive vice president, Professor Kabade. In his unit, we have three vice presidents for medical education, Dr. Sensai, vice presidents of accreditation, Dr. Lakidalu. We have healthcare development vice president, Dr. Kadus Timam. She's a transplant hepatologist out of San Francisco. Under Dr. Sensai, we have Director of Mentorship and Faculty and Staff Development, Dr. Woodner. And we have open positions like Director of Research and Director of Curriculum Development under Dr. Kabada. Then under the CEO, we have the Chief Operating Officer, Dr. Abraham. He has an open position for Director of Monitoring and Evaluation. The country program that we run in Ethiopia, which is run by Dr. Zodu, is under Dr. Abraham too. And we have Director of Public Health Programs. This is an open position. We need a volunteer for that. And we have the Emergency Humanitarian Assistance Lead. So Dr. Abraham is currently doing both positions as the Chief Medical Missions Head and the COO. And we have also under the COO, we have the Education Sector Emergency, which is led by Addis Amro. She is working from Denver, Colorado. So we have the finance team. We have the Chief Financial Officer / Treasurer, Atu Isaias. And we have the Director of Finance and Compliance, Atu Israel. And we have open positions, grant administration, controller, and accountants here. We want to fill that. The HR director position is still open. Our IT division is headed by Joseph Bogala. Under him, we have Azeb Niki Abara as a project manager. And we have IT officers, Sabrina, who is doing her PhD at Ohio State, and Gera, that works out of Alice. And he's helping us on the website. Now we have modified the website very well. The Vice President for Organizational Development is open. So we have that. We highly need the Director of Communications here and Director of Business Development. So we need 2 volunteers who have experience on that. And the Vice President for Horn of Africa Affairs is Professor Anne Fitzgerald. And the Director of Operations is Miss Ade Hailu. She works from New York. And she's also our representative at the UN headquarters in New York. So this is a more modified organizational structure. So we need more people. So our organizational registration here in the US have been updated. So P2P currently now is positioned to take assistance and acquisition or contract grants from the US government. And currently P2P is headquartered at Thompson Station, Tennessee. So we have the following existing partners: World Bank, Federal Ministry of Health, Ethiopian Airlines, University of Kentucky, Wisconsin, Addis Ababa University. So these are our existing partners. We have new partnerships in the pipeline, the CUGH, which is a consortium of universities, especially in Canada and in Europe. We have added memorandum of understanding with MOE and FMOH, and we have additional partnerships in process: RC University, Samara, Wolgite, Debre Marcos, with the Ethiopian Medical Association, Human Bridge, Wollo University, UNICEF, CCRDA, and other organizations like UN OCHA. So Several of our key members and delegations have been visiting Ethiopia and following up on our current medical missions and so on. Dr. Abraham, Dr. Lekidelu, Dr. Kabede, Dr. Naugao, Dr. Tedla, Dr. Hirut, Ms. Addis, Ambassador Burhanam, Professor Ann, all these and others too have visited Ethiopia and contributed, to the emergency humanitarian assistance and other matters. Networking with Federal Ministry of Health, Ministry of Education, universities like Gondar, Bahar Dar, Debre Marcos, RC, Samara, North Wollo, North Shoa, and Afar. All these sites have been visited in the last year. We also have, as Dr. Gabayo said, we have a standing committee at the Ethiopian Embassy working on the US side of COVID-19 issue and prevention and control in Ethiopia. So our current focus areas, I will break them down by key program areas. The first one is clinical medicine and related issues. We are working on a 5-year strategy. This is Dr. Kabede's unit, and we are looking at improving quality of medical education, clinical research. We had a journal of Horn of Africa. It has stopped, but we want to restart it again. And we want to emphasize on quality clinical care development and lab capacity development. As far as public health goes, we are working with USAID and CDC on broad-based interventional public health programs like HIV/AIDS, TB, RMNC, HFP, COVID-19, and health system strengthening and global health security. This is an important agenda because we have seen the devastation of COVID-19. So we are helping our colleagues in Ethiopia in capacity building of the global health security. Tertiary education is one of the areas we are looking at faculty development, quality assurance in curriculum development in medical schools, and USMLE prep and guidance within Ethiopia. We want to start USMLE preparation and exam in Ethiopia before they come here. So we are working on that. The emergency humanitarian assistance, we had hands-on consultations, provision of equipment and supplies and mentorship. We have K-12 school rehabilitations. We rebuilt schools. We provided school supplies for students, including computers, books, etc. And we have provided WASH program supplies for emergency assistance. Horn of Africa Affairs, we are organizing peace conferences and capacity building of mass media for peace building. I'm trying to rush a little bit. So we are developing a strategic plan. We have finished a 56-pager strategic plan assessment phase. It included all the 4 key development areas. So what did we do last year? We wrote many project proposals. We transferred cash delivery to NDRMC. We supplied medical equipment to Walda and Debre Marcos Hospital. We are working with Debre Marcos University in their website development and so on, and others too, and beyond. We are working with Bank of Abyssinia to collaborate on P2P programs. We have a beautiful boarding center in a place called Amanuel in Gojam, and most of our orphans over there graduated in engineering and doctorates and so on. Recently, we have a story of one of our orphans who had graduated in medicine and working in medicine. So that's one big achievement. So it's called the Amanuel Girls Boarding Care Center. We also have a P2P USA Child Sponsorship Project. supporting 14 orphans in Addis. We have the Finland Child Sponsorship Project, providing school expenses for 10 orphans in Addis. We rehabilitated the Wurgesa Primary School, and the others I have mentioned. I'm going a little bit faster. We had carried out a conference, peace building conference in Addis. All participants came from Somaliland, Jubaland, North Sudan, South Sudan, Djibouti, Eritrea, and Ethiopia. Professor Ann is currently participating in the Tana Forum in Bahar Dar. So this is our finance. It is tiny, but we have spent, our expenditures were around 20 million for our programs. This include medical equipment, around 13 million. Now maybe the math has changed. It can be more up to 20 million now. We have also spent around almost 2 million for the Wurgesa Primary School. And we are building another one, Bati and so on. So we are trying to build that. And we are supplying school materials in Afar for the Afar children and Northern South Wolo area, children in those areas. And the fund transfers for the Ethiopian emergency were around 23 million. If we add the staff time, it adds up to 113 million spent this year. So we have submitted key programs, PEPFAR funding for HIV/AIDS and TB, which triangulates 23 government medical schools, a volume of 3 million, fund volume of 3 million USD per year. We have a local organization network proposal also, it's a 9 million. And we have an annual program statement, which is submitted for the US Embassy, which is with a fund volume around 200,000 per year. So we have submitted those. And we are working additionally closely with Dr. Leah, the provost of St. Paul Medical School, Debre Marcos University, Bahar Dar University, Gondar University, Wollo University, Wolda University, and so on, in many areas in supporting policies, essential drugs, pharmaceuticals, etc. So, the health system of Ethiopia, this is a federal ministry health system. We have 3 tiers, primary, secondary, and tertiary tier. So I brought this to compare it with the university hospital system, which is not governed by Federal Ministry of Health. It is under Ministry of Education. It's only connected with FMOS through data sharing and policy advisory, etc. So I brought this because we have to really focus on specific institutions when we try to support the Ethiopian health system. Do we want to go to the academia, or do you want to do direct interventions using the FMOH system? So for our Healthcare Alliance team, I want to mention the following individuals. Dr. Abraham Betre. These are beautiful human beings that really, really supported the Ethiopian people out of their pockets. These are 11 or 14 doctors, okay? We want to expand this number of people to 90 or 100 next year, because only 11 or 13 doctors have spent around 20 million to support, all those hospitals with equipment, and mentorship and direct hands-on. So Dr. Abraham Betre, Dr. Tedla Tsamma, Dr. Getachew Weldeher, Dr. Abraham, you will help me on this one. We have Sister Sarah Gabrol, Sister Hirut Gabrol, Dr. Hirut Gabrol. We have Dr. Nuru Robi, Dr. Girma Zodu. Who else? Dr. Getinat from Canada. Sister Bethlehem, yeah. Who else? Dr. Ephraim and Dr. Elias Shaman. I just want us to clap for them, because they have done a great job. These are beautiful human beings. And let me finalize.
Okay.
Yeah, let me find. I think we know what to do, but for further discussions, we can make time with me, and we can further discuss on what to do in the future with P2P. Thank you very much.
Thank you. Very good. This is very impressive, informative. P2P, we thought Dr. Nago, Dr. Kapare, Dr. Antanas, but there is more to it actually. Honestly impressive. Great job. Okay. Our next speaker is Dr. Abraham Batra. He is a OBGYN surgeon from California at daytime, at night he volunteers and COO for P2P. Really, he and his colleagues have done remarkable work by going to Ethiopia in the middle of armed conflict. It was really quite impressive. So, Dr. Abraham, the floor is yours. Even though you did great things, still 10-minute warning will apply to you too.
Thank you very much, Professor Yunus, for giving me this opportunity. And I would like to thank Dr. Naga for this platform, for giving us the platform to speak our mind and to say thank you to Ethiopian people. And I would like to thank, first of all, for our beautiful sister, Dr. Antanas' wife, for giving us this opportunity today to this is the resilient group. I call them resilient group because we didn't back down for GPLF's agenda. At the fourth quarter, our university backed in and prevent us to go ahead with our presentation. But this family give us this opportunity to say. So that one of the reasons they say that they cancel it because of my presentation. I think they're afraid that I'm going to show some videos which show that what they did to Afar in the Amhara region, the everlasting damage to our infrastructure, our healthcare system and education system. So my presentation. By the way, Healthcare Alliance for Ethiopia is a people-to-people's medical mission, which was established last year in September of 2021. The reason we established it because, you all know what happened in 2021 when the second war broke out. We all were very upset and we were distressed what to do. I didn't know what to do. It affected my professional life, it affected my personal life. Actually, my patients know me I'm a quiet person, very soft-spoken, but lately I've become very loud. I used to say my patients, push, I will help you. Now I'm grouchy, I say, push! Yeah. The answer was, I'm pushing, painful. Then supposed to hurt. This is labor. I didn't say that, but I wanted to say that because it was very difficult. But I went to the people-to-people forum and I asked for help. That was that's a great group of very dedicated Ethiopians gathered together. Initially was 8 of us. And the first meeting we had was our discussion was how we're going to do this. Are we committed for this task? It's a big task. The problem, the magnitude is so big. How are we going to challenge it? Every one of us said, you know what? One at a time. We can do it. So on the same day, we committed that from $500 to $1,000, each of us is going to contribute. On the first week, we were at $20,000. And our goal is for each mission, when we go to Ethiopia, to spend $1 million. $1 million Ethiopian dollars. Plus, We're going to support our experience ourselves and bring supply. So the first, so the first mission was held in Gondar Hospital. 3 physicians went. They took the supplies for themselves, their own supplies. One anesthesiologist, one orthopedic surgeon from Germany, and another internist from America. They spent about a week in Gondar Hospital. It was very valuable trip. That gave us a lesson for the next 2, 3, 4, 5, we're on the 10th mission right now. So when they went over there, what they have seen is very, very painful. A lot of our soldiers and wounded soldiers are waiting for orthopedic supply for months, 2, 3 months. Most of them, they're amputated. Most of them are infected, and they could not be fixed. So when they presented to us that time, so we gathered together, we distributed actually a survey to our friends, and that to our surprise, our 70 physicians responded by saying that we were going to support you guys. Go ahead and let's have a Zoom meeting and fundraising. On the first fundraising, the people to do to help, we raised over $70,000. Most of you guys are here, the big donors. Thank you for that. We appreciate it.
Almost touched on. 1 second.
With that money, the second team went to Ethiopia. I was one of them. Actually, I was about to see Professor Jonas for depression, but give me a deep treatment. After that, I'm cured. I can't come to them. And what I've seen and what the damage they have done to our people is unbelievable. But it gave us a very strength to continue to move on. And the third trip was held in Bahardar, Debre Berhan, and Addis, and also to Debre Zeit. 6 physicians and nurses went to and spent also over $40,000 at that time, plus the supplies they took with them. Okay. So I think this speaks loud. If you guys can bear with me and listen to this. This is our production. It should play.
Such reference.
Okay.
These are the physicians you have seen, the first group.
The suffering of our people late in 2021 from the direct and indirect impact of the civil war in the northern part of Ethiopia continues to affect all of us in the diaspora. Thousands of innocent lives have been lost. Recent reports by the government highlight that more than 11 million people have been displaced from their homes, over 3,000 health facilities, 4 blood banks, and 125 ambulances worth approximately 40 billion birr have been looted and destroyed in Afar and Amhara regions. Millions have been displaced and have been subject to unfortunate and expected misery. Many deaths continue to stem from indirect causes, including war-induced poverty, disease, hunger, and medical shortages. Healthcare Alliance for Ethiopia, HCAFE, was founded in 2021 by like-minded healthcare professionals of Ethiopian origin under the auspices of P2P. The founding members are 11 medical professionals from the United States and Canada. HCAFE members held weekly meetings to structure and define the program objectives, missions, and vision to develop a program that will have a sustained impact on the healthcare crisis in Ethiopia. These 11 members committed to a sustained monthly financial contribution to purchase medical equipment and supplies to support the planned medical missions. Since its inception, HCAFE has been hard at work engaging volunteer for medical missions to travel to the affected regions of northern Ethiopia and provide valuable hands-on medical services. Bringing together Ethiopian healthcare professionals in the diaspora and provide the much-needed support to the healthcare crisis in Ethiopia through provision of medical supplies, equipment, knowledge, and skill sharing, volunteering in medical missions, close collaboration with the Ethiopian MOH to expand and develop the existing primary, secondary, and tertiary healthcare system. Bring together and unify additional volunteer medical groups of Ethiopian diasporas for greater impact. Elevate the standard of the Ethiopian healthcare through education, knowledge, sharing, and by bringing to our country the latest in medical technology and advancement in close collaboration with medical academic institutions. HCAFE has performed over 4 medical missions since October 2021. Each member of any given medical admission has self-sponsored their travel, accommodation, and other costs of the mission. During the first and second medical mission, in addition to provision of medical supplies and equipment, the HCAFE team had an opportunity to assess the overall healthcare, institutional capacity, infrastructure, human resources, and the medical needs of the hospitals. HCAFE has partnered with the leadership of the Ethiopian Ministry of Health and aligned our mission and vision with that of the Ministry of Health of Ethiopia. We have strongly advocated and facilitated the process and flow of delivery of medical and other goods from the diaspora to help the affected area by the civil war. Over 10 million of ETB and equipment have been donated by volunteers. In December 2021, HCAFE, in collaboration with P2P, has carried out a fundraising event, petitioned and urged medical professionals of Ethiopian origin in North America, Canada, and Europe to contribute to this noble, because it would be financially or in person for medical missions, and was able to partake around 80 medical professionals. In February 2022, we ran a successful online fundraising event. Over 70 individuals participated. HCAFE participated in the twinning project organized by FMOH of Ethiopia to help the war-ravaged hospitals. HCAFE adopted and have taken the initiatives in health facility restoration plans Tenta and Walda Hospital. HCAFE is so proud to see Tenta and Walda hospitals providing services.
The last speaker for this session is Professor ETHIOPIAN Abebe. This is about AFRI. It is an alliance for research, innovation, and education, partnering with Ethiopian universities. Professor Abebe is endowed distinguished professor, chair of the Department of Natural Sciences, and chair of Council of Elizabeth City State University. He and his friends has been doing such activities in regard to research and innovation, mainly on concentrating on education for the last year or more. And he will update us the achievements and the things that they have accomplished. Professor Abebe, that's the floor for you.
Good morning, good afternoon, and good evening, wherever you may be. I apologize for being late anyway here in joining you. The screen was mute for a few minutes, so I was not aware of what time to start. So thank you for inviting AFRI. First, I would like to thank People to People and the organizers for inviting AFRI to share our very, very small experience, because compared to what I have heard, that experience is very limited. Now, AFRI is an alliance for research in innovation and education. and it has a very clear and specific mission, and that is improving well-being of society now and generations to come through education, research, and innovation. So those are the three branches where we focus, or we hope to focus. It's more of an aspirational organization, very small and with only very few years of experience. Our vision ultimately is to create better opportunity for everyone by inspiring and sharing knowledge to achieve the fullest potential, participate in and contribute to the betterment of society. So basically, this is an organization that tries to help through knowledge sharing. That's the ultimate. These are the members of the lead team: Tesfaye Mersha, Jonas Telahun, Kasang, and myself. But we have about 200 members. The membership is relatively a loose group of education experts, technology experts, expertise in all fields of science, and most of them are found in North America, but also basically in everywhere in the world. We have Australia, Africa, and Europe as well. And I'll go over some of the things we hope to do now. As I said, this is more of an aspirational organization, very few years of experience. So I'll just briefly share what we have done or hope to achieve during those years. Now, the focus primarily has been partnership that we created with Bahir Dar University. And I will answer first one question before we go on that. Why did we pick Bahir Dar University? Is that we wanted to use Bahir Dar more of as a pilot program where we evaluate our process instead of doing, trying to do a big thing with a very limited resource. We thought it's better to think big, start small, and learn from that experience and expand. So this was more our pilot program, and primarily because the president, Dr. Frey, visited the United States, and the idea of creating this organization or alliance was because of that. And we already have developed a strategic document with Bahir Dar University, and we have signed that agreement. AFRI also has organized a number of visits, not only members, but people who are going to Ethiopia. We encouraged and linked them with Bahir Dar University to go and present, give seminars. So the task force or the team members have been there, but more than that, any member who's going to Ethiopia, we have encouraged them to go to Bahir Dar, give a seminar, and discuss what their project is, especially researchers. Now, the other one is, of course, several times Dr. Frey, who is the president of Bahir Dar University, visited the United States, and through AFRI, we have tried to create a linkage of the university with the University of Cincinnati, Purdue, University of North Iowa, and other organizations as well. So he has visited these places. In fact, some of the pictures you've seen and sees not only him, but also the president of Debre Marcos University have come and visited to collaborate with universities in the United States. This is one of the visits to Purdue, which actually they did twice or three times already. Now they are trying to create a linkage and projects shared between Bahir Dar University and Purdue. Now, the major activity that we mentioned that we have been doing is one focused on grant writing. These activities are based on assessments we made and confirmed needs in Bahir Dar and areas of higher education in Ethiopia. Now, the skills in grant writing we found are limited, and we thought that would be one of the tools to empower the faculty would be a better way than actually to provide funding from our source. So we have done already 2 trainings of writing grants or grantmanship, and these are the expertise that participate in presenting those or providing those workshops. And some of these actually work in US funding agencies like NIH, NSF, and so on. So they have a very clear understanding of what's expected from grant writers. So it was a very well attended workshop. I think in one of them we had about 1,000 people registered, and you can see what probably you'll see later. These are the participants have come from almost all universities in Ethiopia, about 50 or so universities. So this is not focused on Bahir Dar only. The main theme was to train Bahir Dar University faculty, but we created provided the link to all the universities, and those who were able to attended. I think we might have had about 500 or 600 participants. And we evaluated our performance, whether this was a beneficial training or not. And overwhelmingly, this has benefited the faculty, and this was faculty focused. Now, the other trend, what we have tried is, if you teach them how to write grants, that may not be the best way to do it. So what we thought was a one-to-one mentorship and confirming grant writing with a close support was a better idea. So what we proposed was for Bahar Dar University faculty to request mentorship, and we provided basically one mentor for each of those faculty. And that's one thing we did. And there are, I think, a number of those individuals. These are the individuals who received mentorship for almost 8 months or so in writing grants, developing idea and research. But not only that, we also have discussions to develop or strengthen the journals that had been published within Bahar Dar University. We know there is a tendency to focus on publishing abroad in high impact journals and so on. And that's the very fact of writing good papers or excellent papers and publishing them abroad overall drains local journals. The best would be to strengthen local journals and improve their quality so that others from abroad would like to publish in those journals. So we have been supporting those journals as advisors, reviewers, and authors. And that's one of the things we wanted to do, actually encourage local resources. Also, our members have participated in conferences that were done at Bahar Dar University, and we have partnered in developing those conferences. Now, there was another workshop also repeated actually on data science that was organized by Cincinnati. So Dr. Tasfai Mersha was the one who organized it, and this was probably done 2 or 3 times already. And there have been, again, about 500, 600 participants. And you can see the evaluation of that survey. Overwhelmingly, the green and the orange shows you the satisfaction rate, and those are the close to 90, 95%. The other issue is when we visited Bahar Dar University, they raised the issue of team science, where there is a tendency for faculty or professors there to be more of individualistic in their approach. There is a lack of group or teamwork. Developing team, whether in the sciences or in other areas, was very weak, especially at the highest level. When the faculty reach the professorial position, they tend to be aloof. And that was the question we were asked: how do we encourage people to work as a team? So we provided, or we recruited experts within the US to provide those trainings on team science and at least how to encourage for the administration, how to encourage people to, or faculty to work together. You can see the participants in at least in the team science. I think probably participants came from about 40 or 45 universities, but the majority of them were from Bahar Dar, Gondar, Debre Marcos, and so on universities. Currently, we're working with both Bahar Dar University and Debre Marcos University, and the idea is to bring them together to develop projects. And 2 areas have been picked by the universities to focus on. One of them is looking at the area biodiversity and making sure that we sustain our environment for the betterment of the future generation. And the other one is focusing on improving the productivity of TF. So in both areas, experts in the US are helping these 2 universities to have a merged one project and submit it to funding agencies. Now, you have brilliantly presented the video showing the seriousness of the conflict Ethiopia went through the last 2 years. Now, AFRI tried to also, like what you were doing, to help a little bit by creating task force. We developed task force that primarily wanted to address few issues, and the most active task force were public and mental health, education, the publication and counter of misinformation group were the most active among the established ones. The publication and counter misinformation group has published a number of important papers which have been used to discredit the misinformation that was actually campaign. It was a social media campaign that was supported by TPLF, of course, and a lot of funding from abroad. So the idea was to make sure that the scientific media remains untouched by the counter misinformation group. So members have, the task force have published a number of papers in this area. You can look at this yourself. Professor Jonas himself has participated in this, the mental health app, and he's one of them who led that group. So they also have give training, the training of the trainers, and this was primarily on mental health approach and the management of patients with trauma. I think Harvard, a team from Harvard and from Barrow Neurological Institute were the ones who led the training of faculty or medical participants from the Ethiopia side. Now, this year, what we're trying to do is actually maintain a sustained seminar series, and there might have been 5 or 6 of them until now, and we'll continue to do that monthly for Bahar Dar University faculty, but we also, these are open for everyone who wants to participate. But there will be a continuity so that we can engage faculty in and improve the academic environment there. So the question is, how would we evaluate our success? Well, we will be looking at these universities to submit grants, compete, and get funding to do the actual strong and very supportive research. That's what we would like them to do. We would like them to develop teams that will work together and be productive, increase their production of publications, the quality and impact as well, and ultimately strengthen the university to make it a better university. But of course, as soon as we have the strengths, the idea, currently we're expanding to Debre Marcos University, but we would like to expand it to other universities as well. By the way, the biodiversity project involves Addis Ababa University as a counterpart as well. Now, the AFRI's focus actually is to create a database where we have all expert Ethiopians and those who would like to support Ethiopia have their information archived, and Ethiopian universities can use that database to search and collaborate. We don't want to be the middleman. We just want to make sure this database is established. So the initial idea was simply to create a platform where Ethiopian universities will have resources to follow, to look at, contact, and collaborate. The issue just, we were very much diverted all effort in the last 2 years into addressing other issues as well. But that is the main focus. And we have about 200 participant members across the globe. I think now, one thing people to people can do is, especially since you are focused on medical education, we're more than happy to work with you. AFRI invites you, your partnership. So I invite members of people to people to register themselves there so that whenever the educational institutions from Ethiopia would like to collaborate, they can simply search individuals and they can create professor to professor or university to individual researchers linkage. The database or the website is afri.org. You can easily go in. Some of the expertise we have are limited, the field of expertise, but generally it covers most of the ones that we have at the moment, unless you have a very specialized field. Thank you for your attention. And if you have any questions, I would be more than happy to address.
Thank you, Professor Abebe, for really showing us how we are able to walk, not only the talk, because it seems that even though it is a short period of time, it seems that you have accomplished and able to attract a lot of individuals from the motherland. I think because of the interest of time, we need to quit because we have to have other sessions coming, unless there is a burning question from the audience. Okay, so we'll have a break of half an hour for lunch before we start the next session. But meanwhile, there is a keynote speaker who is not here from actually from Bahar Dar. The only time she has because of crowded time is around quarter to 2. So while we are eating our lunch, I think we are able to listen. Thank you.
How is the conference going?
So far, it is good. It's good. So we will update you next time. There was some kind of mishap. So it depends on our resilience. So we are able to be successful so far.
Oh, fantastic. Well, you guys are always really good at being flexible.
Yes, we never give up.
Where are you in Washington?
Sorry?
Where are you in Washington?
We are in one of our friends' house, actually.
Ah,
There was some mishap, so unfortunately it didn't go to the same oven. We have to change and we have to design our approach. I know you are very crowded, so we will start. So the session, Professor Anna is going to be the keynote speaker for today's session. She is international. She's a professor of international security and director of the Berkeley School of International Affairs in Waterloo, Iowa. She has many awards, many accomplishments, but the only thing I want to say is she is a truth teller. Truth is an achievement. Usually it requires vigorous evidence-backed information. So Professor Anne Fitzgerald is truth teller, not only in Ethiopia, it's the whole East of Africa, I would say, with many years of experience. And we want to hear from her about the interrelationship between health and national security. Thank you, Anne. That's the floor is for you.
thank you very much. And I'm so sorry for having to change my time today. Can you hear me? Everybody can hear me?
Yeah, we can hear you very well.
And I'm a bit dressed up because we're going to a state dinner tonight here in Bar Herdar. So I'm out of my suit into appropriate clothing for this audience. Thank you so much for hosting me at the conference. It's a really important conference, and I'm a real fan of everything People to People does, and all the wonderful members that are part of the organization. And I really feel, and I've always felt, that there is so much merit in having a bridge between the rich thought leaders in the diaspora community and those rich thought leaders here on the ground, many of whom are here with me today. And I know that they appreciate everything People to People does as well. And the diaspora thought leaders have been mentioned over and over again here in Bar Herdar over the last couple of days. And so, you know, you're never too far from the thinking on the ground. I think I would like to share 3 things today on issues concerning health security. We've moved away from traditional definitions of security over the years to something that has been known as human security. Health security became an important pillar of that human security equation really during the pandemic. And it's a pity that we didn't get organized more around the issue of health security in the context of national security much earlier. Because it was during the pandemic when certainly Western societies and many others really felt under threat. And societies like the one that I come from in Canada, and many of you come from the United States, we don't typically feel that our direct and immediate surroundings and our borders are under threat. But beyond the pandemic, I've always said that to manage your own natural and national resources properly, you need a healthy society. You need a healthy society by way of just scientific health and biological health, but also through intellectual health, and you can't grow that intellectual health unless you are healthy and strong to begin with. So the three things about the importance of health security is, one, we've got to get behind institutions more. It's very, a book was written in 2012 about why nations fail. And it's all about institutions and keeping our institutions strong. And it seems very easy to discredit institutions in this day and age and be very critical about institutions in the age of the internet, and with very poor policies on the internet and poor approaches to internet governance. And this has to do with our health services agencies and our ministries of health as much as it has to do with our policing institutions and our other national security institutions. Because as we found out, as Canada, as a country during the pandemic, once you discredit your institutions and are very critical towards them, and as leaders become less and less incentivized to stand behind them, then they're not much use in the longer term and when you really, really need them. Institutions are also strong pillars of the commons. And when those pillars start crumbling, democracy from within starts crumbling. And whilst democracy and market capitalist progress, especially nearby groups that are not seeking to see such progress happen, institutions become easy targets to delegitimize and take down. And this is not just happening on the African continent, it's happening elsewhere. So it has implications for leadership, but leadership at all levels of society, not just public sector leaders, but private sector leaders, civil society group leaders, the media, reporting accurately and more positively about institutions instead of destroying them. So healthy societies require good, strong institutions. They're the heart of the commons, the heart of the democratic fabric, and they need to stay strong to keep nations strong. And any risk to institutions is risk to democracy. So to make health and health security an essential part of national security, we need to stand by institutions. We need to encourage leaders to get behind them as well. The second thing I would say about health security is the importance of data. We live in a day and age of misinformation and disinformation. And I found it extraordinary that countries like Ethiopia only had baseline data on certain issues concerning health security, concerning demographics. There were forecasts, but there wasn't real authentic in so many different ways for the sake of groups seeking to delegitimize institutions and delegitimize authority. So data becomes really important in an investment in data institutions, including those institutions mandated to house statistics, to inform meaningful policy on health security becomes incredibly important. So it's not just the institutions that implement health policy and health security, it's the institutions that are responsible for housing data and, I would say, keeping data green and fertile to help inform policy on health and policy on health security. You can't manage what you cannot measure. So in developing health policy goals and health policy objectives, it's important that over whatever strategic time horizon you're trying to implement these objectives, be it the 3-year time frame or a 5-year time frame, milestones to try to aspire to achieving become really important. Those milestones need to be enumerated and quantified. And when milestones are reached year on year, quarter on quarter, 6 months on 6 months, whatever the reporting cycle is, that's a real lever for further strengthening or weakening institutions. So data is not just important to keep institutions and agencies supporting health security strong. It's important to manage what it is that you're trying to achieve. So we've got to remember that we can't manage properly what we can't measure. And I think we need to acknowledge the multidisciplinary nature of health security, and therefore healthy partnerships to promote health security become really important. Partnerships with like-minded countries, countries that come from different health security experiences, and those partnerships can be in the form of international assistance, but they can also be in the form of exchanges, mentoring relationships, but not just countries that we're comfortable with, countries that we perhaps haven't cooperated with over the years, but who have taken innovative approaches to health security, including African partners as well. There's all sorts of great innovative nearby cross-border partnerships and collaboration that's happening right on the continent now. So it's not so necessary to go to the UK or default to the US as the first ports of call for expertise in health security. And the last thing I'll say that's related to that concerns education and capacity building and education. And I know this strikes at the heart of People to People as an organization. It's been contributing a great deal to capacity building in the educational sector to strengthen health security programs, health science programs. And I think that can be scaled up and further emboldened to reach health security more generally, not just health sciences, but health security. So in certain national security programs, it's important for research and data and models and approaches that are practiced by health scientists and health practitioners to contribute to the thinking of national development studies and the development sector more broadly. It's important for health security to be linked to this. And, you know, as we are realizing every day in our own societies, the time has come to really decolonize, in our experience, our academic curriculum and think about how we don't keep trying to build on traditional faculties and traditional university structures, which in time are becoming more and more outmoded and outdated. The time has come to think with fresh ideas and fresh models and start building curriculum and designing university structures from scratch again, and to ensure that the multidisciplinary nature that is so important for health security and taking health security as an equation forward is practiced. You know, sometimes that traditional structure in universities is also promoting research activity in traditional silos as well. And to move forward with a broader approach to health security, we need to acknowledge that that's multidisciplinary in nature and recognize the value of multidisciplinary research. And I know that there are certain members of People to People who have published in journals linking health security issues with conflict and other vectors in the debate, all of which is super important. So I'll just finish by saying thank you so much for having me into your annual conference for a second year in a row. That has been changing a lot here in Barher Dar to be with you, and I pass the baton back over to you. Thank you very much.
Thank you, Anne, for your insightful talk, not only based on what we read, but based on your personal experience by doing all those activities for the last so many decades. Maybe one question, as you know, health is not only a national problem, it is an international issue. We have witnessed it during the COVID-19 era. So what do you think the role of international societies, even though quote unquote UN and other organizations, their role should be in helping those who are maybe resource constrained societies in Africa and other parts of the world, including maybe the developed countries? Thank you.
Thank you. Well, it's not a good day to ask me about the international system of governance because it's, I don't know, it seems to be gridlocked in many different ways. And in my view, it's the agencies that do the good work on the ground. A lot of the humanitarian partners, a lot of the operational agencies. Where we look for policy from these organizations, it's lagging far behind the ground-based reality. And I also think that unless you have your own house in order nationally, you cannot implement regional conventions or multilateral policy on these issues. So, you know, I think it's incumbent on countries like Ethiopia to develop their and try to bring vaccination. Whatever those vaccine programs are in the future, they immediately receive terms and conditions and principles on which Ethiopia would administer its own vaccines or administer, you know, okay, let's take artificial intelligence as an example. Ethiopia is currently trying to unfold AI solutions to address issues like backlogs in the health systems, early scanning for preventative purposes, using smartphone technology. And they're realizing that there are other important pillars that need to be addressed to take that forward in a comprehensive way. For instance, doctors, especially practicing in rural areas, are more comfortable with a paper and pen. Hang on, let me just, I'm using my phone and I'm getting an incoming call. And so there's a broader change management program that has to be used to promote wider health security objectives. And the international organizations can't do that. It's got to be owned and driven at the national level. So whatever national security objectives are being practiced in a country, there are implications for the Ministry of Health to model at the implementation level around all the agencies and the institutes to achieve those overall national security objectives, or without, you know, different pillars to prop up certain health initiatives and health policies, the more comprehensive approach won't be there to take them forward. So, and we'll keep hearing different difficulties and challenges from different parts of the wider health security equation. So I hope that's coming across clearly. I guess what I'm saying is the health security challenges are so specific in different parts of the world that you can't wait for lagging, more conventional health science orientated policies to promote wider health security specific needs of a country. And I think we saw this already with the vaccine program that the World Bank and the World Health Organization was seeking to bring to other parts of the world like Africa. So I think a bottom-up approach rather than a top-down approach is necessary in this case, and getting your own house in order as a nation and setting down policies for incomers then to adhere to is important. It's the same thing with foreign aid at the trade assistance. So, for example, the Gerd Dam is has great potential to serve the European Union. It should be something that the European Union is really attracted to at the moment because the EU needs a big win at COP27 this year. And what better projects than the Gerd Dam and the Grandinga Dam to put private investors behind for this global gateway challenge they have, and to scale up into wind power and solar power for more renewable energy sources. It's like a bird in the hand, but no, instead there's this big negative geopolitical debate around the Gerd. What Ethiopia has to think about is when those investors all suddenly start flooding the country and wanting to get behind this excellent homegrown initiative. It's got its environmental, corporate social, and national security terms and conditions ready for these investors that the investors have to meet. Same holds for health security as well. And that's why national policies and the capacity to implement the national policies are important.
Thank you very much, Professor, for your speech and also using very crowded time that you have on the night. Thank you very much again, and I think we finish, and we thank you.
Thank you very much, everyone. Great to see you. I can see now that in the background, and really nice to see you all. Thank you so much.
Bye-bye.
Bye.